This is a demonstration of the passive movement tests that I do to the pelvis. And one of them is side glide. So I'm testing the ability of the pelvis to glide from the right to the left. And of course I would do it on the other side. And then another test is capturing just the outside of the front of the pelvis and then pushing that medially. And what I do is I push it to an end point, all of these tests. That's called taking up the slack. And then I add a little thrust. And after taking up the slack, I'm able to thrust it, it moves forward and it bounces back. And that's also true with the side glide test. I take up the slack, thrust it, and it shifts to the left and comes back. And so that's normal motion. And now I'm testing posterior rotation at approximately a 45-degree angle on the front of the pelvis. And I take up the slack, and you can see it moves, and then it comes to a stop point. And then I thrust it, and it thrusts forward, and it recoils back, and that's normal movement. I do not claim that this creates movement only in the SI joint, but it certainly tests movement going through the SI joint. And muscles and posture can block motion going through the pelvis, and so this directs how I treat it. And if you want to get an appreciation for what blocked motion feels like, then take a piece of foam or roll up a towel 2 inches height by 8 inches and place it underneath the top of the pelvis. Okay, so I'm doing that on the right side, and now you'll notice I can't take up the slack. The motion is already taken up, so I'm not able to induce any motion, and when I try and thrust it, there's absolutely no motion. Now, the pubic joint stress tests, I do not use except in the postpartum states or someone who's had a severe trauma to that area, a birth trauma, and I'm palpating along the front of the pubic bones on both sides, and then I can put the heel of my hand on one pubic bone. I gently take up the slack and then I do a tiny little thrust. And there should be the slightest amount of give, and then you can do it right on the mid fibrocartilage, and then you can do that on the other side. You can then come on the top of one pubic bone, take up the slack and spring it, and it's not unusual for people to be a little tender with that. And then very carefully you can come underneath it and you can do a vertical spring test. Okay? Let's have you lie on your stomach, please. So I like to have them lie as symmetrical as I can get them. And a vertical stress test goes through the sit bone. I take up the slack and I spring it, do it on the other side. I like to evaluate the distance of the sit bones to the midline, and I do a medial spring, okay? And then I also do a lateral spring test, okay? I also test ligament tone of the sacrotuberous ligament, and I also do ligament tone of the sacrospinous ligament, and then the same thing for the long dorsal SI ligament, which attaches right onto the PSIS, so we come right underneath it, and I can walk across it medially and laterally, and I can also indent it and compare sides. Okay? So the other movement test I do in prone is I come to the top of the iliac shelf, and I spring it straight forward, testing forward rotation, do it on both sides. Then I test inferior glide, spring mobility, and then I test a lateral spring test at a 45-degree angle on both sides. And then I test a medial glide on each side. And there's an advanced test, which is springing obliquely. Sometimes someone gets stuck mobility in an oblique manner, either up or down. So I spring up towards the right elbow, and I capture the PSIS, and then I spring infralaterally at a 45-degree angle. I also test anterior spring on the flat part of the ischium, and this evaluates pubic joint mobility. Okay, I come underneath the sacrum. I come on each side and I spring superiorly. Okay, I come onto the tailbone and I come on each side and I spring to the right and then I spring to the left. And I also evaluate the sulcus on both sides, looking to see if there's a side bent coccyx, in which case it would have a deeper sulcus on that side. And then when we come to the sacrum, I spring the left side. I'm at approximately S1, 2, and 3, which is where the joint is. Okay, so that's left and right rotation. When I push on the right, it induces left rotation. Okay. In prone, most people do not present with a torsion. And a torsion is an interesting twist on an oblique axis in which, if you separate it into quadrants, one quadrant becomes prominent and stuck in terms of forward spring, and there's also a side bending element. There's 4 different types of torsions. You can find a book chapter I wrote on that on my website, HeschInstitute.com, spelled H-E-S like Sam, C-H, sacral torsion. Do a search on the top right. But if he presents symmetrically, then what I do is I do a midline thrust, okay, and then I want to see how the sacrum forward bends. So I come up on above the PSISs, and I'm testing forward bending of the sacrum, and then I test backward bending of the sacrum. I also test inferior glide of the sacrum, okay? And then to look for torsions, they manifest more in flexion. And so I will have him sit up in a moment, but you can also come up to, so you find the PSISs, that's S2, so a thumb width above is S1, and so this should be L5. Another way to look at that is that the crest is usually at the junction between 4 and 5, so L5 should be right below it. So I'm pretty close both ways, and you can do a midline thrust, spring testing, and that moves well, and then I come up a ½ inch and work my way up. And you can also test rotation by springing sideways on the spinous process. You can do that in prone, you can do it in prone extension, and you can do it in sitting flexion. So let's have you sit up now and face towards me, and then scoot over to your right so you're not sitting in that crease. Excellent, very good. And so let's have you bend forward a little bit and lean on your hands. So we have to reorient. I come underneath the sacrum, underneath the ILA, and I just do a gentle lift, okay? And when there's a side bending pattern, this motion is absent, but I can spring him on both sides. So I'm looking for his PSISs now, and they're right there. I'm on the very peak of that PSIS. So this would be the upper quadrant, and then down here would be lower quadrant. So with my thumb or with the heel of my hand, I just thrust forward. And in this case, the slack is already taken up because he's weight bearing and he's also in flexion. So I just do a quick impulse, okay? And even with my thumb, I can induce a little bit of force to translate through that joint and into the rest of his body. And when it's blocked, it's very distinct, but he has good motion. So those are the spring tests that I do looking for a possible sacral torsion. And much of what we call sacroiliac joint movement dysfunction can be external to the SI joint. You have powerful muscles there that can restrict motion. And so sometimes with these tests, we're evaluating actually influences from outside the joint, but it does guide our treatment in restoring normative mobility and hopefully reducing nociception and reducing pain. So that's a summary of my pelvic spring tests. Thank you.